name's Elsa. I will be demonstrating how to go ahead and do a 2 view of the chest today. But first, I will go ahead and demonstrate how to go ahead and get the room all set up. First, you want to go ahead and detent your machine at 72 inches from the wall. Make sure that you have it in the wall setting as well. You want to make sure that you angle the machine at 90 degrees, or 90 degrees angle, and you want to make sure that you have it directly perpendicular to the IR. Also too, you want to always make sure that you have your marker in the white field, which I always like to put before I get my patient, and then I can move it around as I get the patient. And I already did start by putting in my 14 by 17 crosswise. My patient will be a male, so depending on how tall they are, normally if they are a tall patient, then you would put the IR landscape. Okay, now I'll be going to get my patient. Mr. Beaver?
Yes.
Hi.
Hi.
Mr. Beaver, can you confirm your first and last name and your date of birth, please?
Yeah, it's Justin Bieber, 7/14/1993.
Oh, awesome. Okay, well, Mr. Beaver, is there any possibility that you might be pregnant before we start the...
No.
Okay. What's the reason for your exam today?
It's always singing on tour. It's affecting my chest. It's been hurting the last couple of days.
Oh, so you've been having some problems breathing. Okay, well, we're going to go ahead and start off with the chest X-ray, which I'll have you facing the board.
Okay.
So if I can go ahead and have you face the board for me. Perfect. And what I'm going to need you to do is just lean forward, relax your shoulders, and bring them in. So with this here, you want to make sure that you move your marker out of the lung field and get it into the light field. You also want to center at T7, which I will go ahead and do. So T7, and also the biggest thing is you want to make sure that your IR is perpendicular with your CR. So Mr. Beaver, can I have you bring down your arm? And you're going to feel the board come down just a slight bit. Perfect. Okay, go ahead and put your arms up. And also too, you always want to make sure that you shield your patients. Alright, Mr. Beaver, there's a shield right behind you. Please don't step back. For a PA chest, you definitely want to go ahead. My technique that I would use will range within the patient. So I would go anywhere between, we'll just say 110 to about 120, and for the mass, I would go anywhere between 4, 6, or 8. Okay, Mr. Beaver, I'm going to have you take a deep breath in, hold that, beep. Go ahead and breathe and relax. You can go ahead and relax your shoulders. So, what I will do at this time is take my cassette, go and run it, come back with a new cassette, and I will go ahead and shoot my lateral view. For the lateral view, you want to make sure that you have your cassette in a portrait. You go ahead and put that. Okay, Mr. Beaver, if I can have you go ahead and face me. I'm also going to go ahead and have you put both hands up here for me if you could, and come all the way close to the board. So for this, you also want to go ahead and center at T7. And the most important thing is you want to make sure that the scapulas are perpendicular to one another and he is not rotated. So you can definitely see that he is perfectly straight on. Another thing too is you will have to just bring down the IR just a slight bit. So once you do that, go ahead and line up. Mr. Beaver, if I can just have you just slightly forward. Perfect. Make sure you always show your patients. For this technique, I would use same kV, but I would definitely increase my mass. So I would increase that by double. So for him, I would probably go maybe about like 8 or 10, but my range would go anywhere between 8 to 12, maybe 14, depending on the patient. Alright, Mr. Beaver, if I can have you take a deep breath in, hold it, beat. Go ahead and breathe. You can relax your arms. And what I would do from here, take my final cassette, go and run it, make sure that I get my views out to the doctor, and we're all set. Thank you, Justin Bieber.
You're welcome.
Okay, so this is the actual cassette, the reader that you would come to. I would go ahead and look for my patient's name, make sure that I open the exam, and mark down the actual images that I'm going to be shooting. Once I go ahead and get my images X-rayed and taken on my film, I would go ahead and scan it, and then go ahead and run it in the cassette reader. But that's how you would read your cassette. And then once you're done, you go ahead and suspend it, and it goes over to DICOM. Okay, so now I will start off by evaluating the images that I took. First, I'll start off with evaluating the PA chest and moving into the lateral. So here now I will demonstrate you the PA chest. There's a few things that you want to go ahead and look for. First off, you know that you do have to center at T7, but overall you want to make sure that the scapulas are out of the lung field. You also want to make sure that you have full inspiration of the lungs. And also that you're not cutting off your apices nor your crossopharyngeal angles. Another thing that you also want to make sure that you include is about 10 ribs showing on the image. You want to make sure that you see the shadow of the heart, and also most important is you don't want to see any rotations along the clavicles and the SC joints. So that would be what you would be looking for in a PA chest. Now moving along to the lateral chest, there's a few things that you also want to look for. You center at the level of T7. You also want to make sure that the patient is not rotated. You do, again, want to make sure you get the apices and the crossopharyngeal angles. You also want to make sure that you have the shadow of the heart as well. Most important too is you want to make sure that you get the patient's arms out of the lung field too, because a lot of times the tissue of the arms can manipulate and look like something else is going on within the lungs. So it's very important to make sure that you get the patient to raise their arms as high as possible. And that would be my critiquing of my PA and lateral. Hope you enjoyed, and thank you.